Hello guys, this is once again Jacob John from Tiju's Academy. Last episode we saw about the do's, what you have to do when you're dealing with a psychiatric patient. Today I want you to know about certain don'ts that you have to follow when you're dealing with a psychiatric patient. The first don't, you should not enter the room of a psychiatric patient without asking permission or without greeting the particular person. For instance, let's take Mr. Alex. Excuse me, Mr. Alex, are you there in the room? This is Nurse Jacob. Can I come into your room? Are you free to talk? I just want to have a small chat with you. I just want to find out how you're feeling. So that is something you have to be careful about. Do not enter a psychiatric person's room without asking their permission or making them know that you want to come inside. Psychiatric patients, obviously their moods are not the same always. Another point that I would like to discuss is when you want to perform some sort of an examination. It can be anything, a small assessment or anything. Or perhaps when you're into the room, the patient will say, let's take our imaginary patient Alex over here. Patient is saying, Nurse Jacob, do you know that I just hit my leg while I was walking in this room across this furniture? So, oh, is it so, Mr. Alex? If you don't mind, please can I have a look at your leg? Would you care to sit down? Would you please sit down? In this way, you are making Alex comfortable. You're expressing your concern. And also, you are telling Alex in a subtle way that you are asking his permission to perform an assessment. And also, don't forget to thank him after the assessment. Mr. Alex, thank you so much for letting me examine your foot. Don't worry, it's just a small hit, in the furniture. So don't worry about it. It'll be all right. You just you hit yourself with the furniture. It'll be all right. I'll give you an ice pack. Just put it on top of it and you'll be fine in no minute. So that is something that you have to follow. That is, when you want to perform any assessment, you should ask the permission. And after the patient has let you examine himself or herself, you should thank them. Third point that I would like to tell you is you should never ever reveal the diagnosis or certain signs and symptoms about the particular disease that the patient is having. First of all, psychiatric patients will be having total mood swings. Sometimes they'll be depressive, sometimes they'll be anxious, and sometimes they'll be totally tired. So the patient, not knowing, they'll be asking, am I having some problem, nurse? Am I all right? Is my brain working properly? But if the scenario is not asking you to do that, or if the scenario is not demanding you to do that, do not reveal the diagnosis or the sign and symptoms to the patient. Why? Because if you tell the diagnosis and if you tell the sign and symptoms 24/7, they'll be thinking about it every now and then. Like they'll be going around, oh, I'm having this, I'm a disastrous person, I'm totally in a disaster. So this is what will be revolving in their minds. And also, when you greet a patient, along with your greetings, do not ask a psychiatric patient, Mr. Alex, I hope you have taken the morning pills or the morning medicine. It is your responsibility as a nurse to give the medicine into the patient's hands. You have to place them onto the patient's hands and tell them, Mr. Alex, this is your morning pill. I hope you're going to take it with water right in front of me. That's the correct way. You cannot just simply leave medicines at the bedside table and you can expect the psychiatric patient to take the medicine as we do with the regular patients. So that is something. And also I would like to tell you one thing. If the patient is telling, I didn't like the taste of the medicine, nurse, and there was one pill, it wasn't working for me, so I just gave it to my cousin, one of my family members. If you confront such a dialogue from the interlocutor or from a patient in a real life scenario, what you have to do as a nurse is you have to find out Oh, first of all, Alex, you shouldn't have done that. But since you have done, can you please tell me which color pill did you give it to your cousin or did you give it to your family member? Is it the white one or is it the yellow one? In such a way, you cannot reverse the effect, but you can understand which pill was given to the cousin or the family member. Alright guys, so these are certain don'ts that you have to keep in mind when you're dealing with a psychiatric patient. I hope the do's and don'ts will be totally helpful to you when you have your OET 2.0 speaking sit test or having a role play card where you have to deal with a psychiatric patient. Once again, Jacob John from Tiju's Academy. Thank you so much guys.